The number one goal of this program is to help prepare you for the treatment of your hepatitis C. But first, it is important that you understand exactly how hepatitis C may affect you. Hepatitis or inflammation of the liver can have multiple causes. One of the most common causes is viral. Viral hepatitis is a contagious disease that in the majority of cases is caused by infection with one of three viruses: hepatitis A, hepatitis B, or hepatitis C. The hepatitis C virus, or HCV, is spread when blood from a person infected with the virus comes in contact with the blood of someone who is not infected. In fact, it is the most common blood-borne virus. Acute hepatitis C infection, a short-term illness, occurs within the first 6 months after someone is exposed to HCV. Some people are able to fight this acute HCV infection off, and the virus then leaves the body. But for 75 to 85% of people, acute infection leads to chronic or long-term infection. Chronic hepatitis C may lead to serious health problems or even death when it's not treated. While there are vaccines to protect people from hepatitis A and hepatitis B, there is no vaccine for hepatitis C. Approximately 4 million people in the United States are living with hepatitis C, and most of them will have it for life. Most people contract hepatitis C by sharing drug needles or other equipment used to inject drugs. However, before 1992, the virus could be spread through blood transfusions and blood products. While blood screening techniques have almost eliminated the risk of contracting HCV through transfusions today, people should be tested for HCV if they have ever injected illegal drugs, received clotting factor concentrates made before 1987, received blood transfusions or solid organ transplants before July 1992, have ever received long-term hemodialysis treatment, have known exposures to HCV, such as healthcare workers after needle sticks involving HCV-positive blood, and recipients of blood or organs from a donor who later tested HCV positive, have HIV infection, have signs or symptoms of liver disease, such as abnormal liver enzyme tests, are children born to HCV-positive mothers. Hepatitis C can happen to mothers, fathers, neighbors, friends, people from all backgrounds and ethnicities. It's very important that you look after the health of those around you by understanding and following the steps you should take to avoid putting others at risk for contracting hepatitis C. Tell anyone who may come into contact with your blood that you have hepatitis C. They can use gloves and other ways to protect themselves. Don't share toothbrushes, nail clippers, razors, or other personal care items. Carefully throw away anything that may have your blood on it, such as tissues, swabs, or tampons, and wash your hands after doing so. Clean any cuts or scratches you have, and use bandages to cover them. Use condoms with spermicide if you are sexually active, and avoid sexual activities that could cause bleeding. Don't donate blood. Don't share needles or other drug paraphernalia. The good news is that you don't need to worry about casual contact. You cannot spread hepatitis C by hugging, kissing, or sharing a drinking glass. Most patients with chronic hepatitis C don't have symptoms. However, if a person has been infected for many years, his or her liver may be damaged. In many cases, there are no symptoms of the disease until liver problems have developed. Whether or not you experience any symptoms now, it is very important to begin planning for treatment so you can reduce your risk for long-term effects of the disease later on. Think of hepatitis C as a tiny bug that has entered your system. Once inside your body, HCV attacks liver cells, using them to reproduce itself. Because hepatitis C can have serious effects on your liver over time, you should know why the health of your liver is so important. Your liver is your body's factory, located in the upper right side of your abdomen. It is the largest organ in your body, and it performs hundreds of important functions, including the following. It acts as a filter, removing harmful substances called toxins and waste from your blood. It stores nutrients, such as certain vitamins and minerals, and it helps make and control the levels of certain chemicals and proteins, including cholesterol, hormones, and sugars. It helps your body digest food by producing a substance called bile. When HCV begins attacking your liver, all of these vital functions are threatened. Your body tries to fight HCV by sending a type of white blood cell, called a lymphocyte, to the liver. But over time, this process, along with certain chemicals released by the lymphocytes, may cause inflammation or swelling of the liver and can damage the healthy liver cells. Some healthy cells might grow back, but serious damage can lead to a buildup of scar tissue in the liver called fibrosis, which causes problems with blood flow. When liver cells don't receive blood, they start to die. As a result, the healthy liver cells are gradually replaced with non-functioning, scarred, and dead cells. This causes the liver to stop working the way it should, and the body can get out of balance. Hepatitis C is the #1 cause of liver failure leading to liver transplant in the United States. If left undiagnosed, the disease may cause liver scarring to get worse or become severe over many years. This is called cirrhosis, and it can lead to liver failure, which essentially means your body's factory is shutting down. Up to 20% of people with hepatitis C will eventually develop cirrhosis, and 1 to 5% will die from cirrhosis or liver cancer. These are all reasons why detection and proper planning for treatment is so important. In the next chapter, you'll learn about a potential treatment option for hepatitis C.